Okay, welcome everybody to the very first Swan podcast. This afternoon I'm going to be talking to a couple of people about the Covid-19 and its particular impact on the BME community. Both in the UK and America, the data is really quite shocking in terms of the proportion of people from the BME community who are more likely to contract Covid-19 and who are likely to have negative outcomes from Covid-19. So one of the questions that we want to ask is, why is this occurring? What are the roots of this? Why is this overrepresentation occurring? What are the implications for social work? And what are the demands that the Social Work Action Network should be placing on government and local authorities to protect our BME workers? With me today, I have got two very good speakers who have got a very long connection with the Social Work Action Network. First of all, we have got Weyman Bennett. Weyman is the co-chair of Stand Up to Racism in the United Kingdom, one of the UK's leading anti-racist networks and organisations. And Swan is an affiliate of Stand Up to Racism, and Weyman and various of his colleagues are often regular speakers at our national conference. The second person I've got with me today is Dr. Gurnam Singh. Gurnam is now the Associate Professor of Social Work and Sociology at Warwick and a visiting professor at Cheshire. But has a long history both as a social work practitioner and a social work academic, with a particular focus on questions of social justice and anti-racist social work practice. In fact, way back in the day, when Gurnam and myself were new to the world of social work, Gurnam was involved in, at the time, what was called SETSWA, which was the Central Council for Education and Training in Social Work. And they, in 1989, constructed a Paper 30, which was a series of demands for educational providers of social work. And for the first time, really, an educational provider in the UK said that it was really important for social workers and social work courses to acknowledge that the UK was an institutionally racist society and look at the implications that that had for social work. So we're really delighted to have both Weyman and Gurnam with us today. And I'm just going to ask a series of questions and pass over to them to address them in turn. So the first question really is to get to the heart of the problem. So I've said the BME community are overrepresented amongst those who are catching COVID or who have had negative outcomes from C19. So the question is, why do we think that's happening? Why is this case happening? Weyman, maybe you'd like to go first.
Thank you very much, and thank you, Michael. Thank you, Gurnam. I'm very glad to be with the Social Worker Network and to speak out about this. And I want to say this is a profound crisis for the BME communities. And the first thing to understand is the interaction between environmental, political, and economic effects have actually produced this. Firstly, let's be clear that the employment and where people live is playing a critical role in COVID. So 50% of all health service staff are BME, and it makes a big difference. And the second impact is they live in the major conurbations. And the third thing is they tend to live in areas which are higher density amongst people. In other words, the Thatcherite cuts, all the impacts of housing all come together. In the Macpherson inquiry, it was called the ethnic penalty of both access to healthcare, social economic in terms of income. In other words, the lower the income, the impact of racism is to sharpen the class experience of people. So people that are bus drivers, cleaners, or working frontline of in the NHS are all subject to this. And we should be clear about something else. People have been denied PPE. In other words, the basic protection in workplaces, and they've also inadvertently come into contact with family members and other people. This, on top of 20 years of austerity, has produced a deadly cocktail, which has led to differential outcomes in terms of meeting the disease. Of course, it is true that people have, they may have underlying issues, but even the underlying issues, as the American study into COVID show, is a consequence of bad diet. Diet is linked to actual income. All these micro events have led up to a macro event in terms of actually leading people to early deaths. And if you want to see racism in class in practice, you have to look at this disaster that we're faced with. And I think that why there has to be a public inquiry is because I think it will open the whole lid on how there was a very clear pour of the coronavirus, and why we have to take action to protect all our frontline workers. But more importantly, we have to hold to account the deaths that have taken place. It's far higher than Germany. It's far higher than other countries. Actually, it's higher than South Africa. Do you mean? So if people want to just say there's biological differences, it's twice as high as places in South Africa. So we should see that this is something which is endemic and is partly, I think, partly heavily influenced by institutional racism. And I'll stop there, because I think unless we get to the heart of this question, I think it shines a light on the inequalities that exist inside Britain. And it's particularly important to social workers that work in gerontology, who work in the front part of the care home system. A slaughter has taken place, and many of those 60% of care workers are people of BAME background. All these things need to be exposed, and their links in terms of the experience of the coronavirus, and we really have to speak out and do something about this.
I think the demand for a full public inquiry is obviously something that we would fully support, and full support for involvement of social work and social work organisations in that process. Gurnam, just hand over to you for the same question.
Yeah, I think Weyman's touched on a lot of really important points. I don't want to repeat those points. Maybe you just take us back to when this illness, this virus, came into the media, and the government response was, this doesn't discriminate. This virus is almost an equal opportunities virus. But the figures that are coming out would suggest that it absolutely does discriminate. Now, what we've been told, I mean, when the kind of official line has been that there are lots of comorbidities, diabetes, blood pressure, obesity, heart disease amongst ethnic minorities. And, you know, we've already heard about the kind of housing conditions. But there's also been some kind of cultural pathology as well, suggesting that religious attitudes mean people are reluctant to follow rules, lockdown, etc. So the same kind of, you could say, cocktail of kind of blame was there, or ignoring the kind of wider facts. And of course, you know, yes, you know, BME communities do suffer from diabetes, blood pressure, obesity, but this is part of a scandal. And, you know, this does make people vulnerable to all kinds of illnesses. And so really, that doesn't mean that somehow they're to blame for that because they have all these comorbidities. In fact, it further shines light on, I think Weyman's used the word slaughter, that actually what we're seeing with neoliberal policies that have been going back, you know, decades, and Mike, you know, I've been writing about this, that actually the next phase of neoliberalism is a kind of genocidal, if you like. It's eugenics. And I would suggest that their failure to respond to the needs of the social care sector, and particularly of residential care, further kind of, you know, provides evidence for an ideology of trying to get rid of people. And can I also mention another group that's really important, which is undocumented migrants. And there's huge concern for this group. They're probably the most vulnerable group, and they're not even counted because they have no legal rights of residence. They probably don't even have access to treatment. And I think there's probably a disaster taking place there that I think that, you know, certainly SWAN needs to highlight. I mean, much of the support for these groups comes from the voluntary sector, from groups that they trust, because clearly if they were caught by the authorities, and they would suffer sanction. And of course, that voluntary sector is now, you know, flagging. It's done an amazing amount of work, but you know, their income base now is deteriorating. So I think that that's a group that, and of course, in that group, they are all by definition minority groups. They're non-British groups. So that's one area I think that we do need to really focus on as well.
Okay, so if both of you are clearly arguing that there's no genetic root to this problem, this is about inequalities, this is about institutional racism, this is about the dynamics of class and race and their impact on particular communities. So as social workers then, Gurnam, what are the particular implications for social work and social care workers of that analysis?
I think, Mike, rather than giving a kind of an academic answer, I want to respond to this by sharing a story of an Australian social worker from a BME background who's working in Australia, and she sent this to me, and she was talking about what life is like for her, and she says, just sharing what my social work world has looked like for the past few weeks, supporting 2 high-risk domestic violence clients, helping mother and child move from a domestic violence refuge, counselling to clients feeling lonely and suicidal due to the COVID lockdown, reading Sikh prayers to Sikh lady dying in hospital whose family can't visit her, providing bereavement support for an 18-year-old whose mother died, and attending the funeral, again, where family are not allowed to join her. And here she's referencing extended family, calling the police where a woman's been beaten by her husband, helping elderly patients, etc. Counselling a woman who's suffering from schizophrenia, and again, no family nearby. And her final thought was, I'm feeling burnt out, fatigue, and there are so many vulnerable people out there not accessing services due to COVID. High unemployment, alcohol, drugs, psychological issues, suicide. So in some senses, it's everything, all of the above. You know, social work at this moment is in overdrive. And if you're from a Black and ethnic minority background, not only are you in overdrive in terms of looking at addressing the issues out there, but you yourself are vulnerable in many ways. Vulnerable. I mean, we've heard about in the hospitals, in the care settings, you know, we have a much higher proportion of BAME professionals and workers being attacked. And I think that's partly due to, you know, age-old kind of negligence against protecting minoritized workers. And I think that, you know, we're seeing that now. And, you know, these kind of excuses that the government's making around, you know, protective clothing and things like that, it just further reveals how bankrupt and how inhumane this government is. And so that's the kind of picture there. So I think it's almost like a war zone now. And, you know, in that war zone, I think that those all workers, all citizens are suffering, but I think those made most vulnerable by institutional racism, by historic kind of targeting, are just there suffering even more. And that kind of example from the social worker really illustrates the kind of stress that they're under at the moment.
Thanks, Gurnam. Weyman, what do you think the implications for social work and social care workers of an analysis which points to the institutional and the social causes of the discrepancies around COVID?
I think social workers are uniquely placed because they're both in the school, they're both in hospitals, and they're in the community to draw together a total picture of what's been happening to communities. Somebody once wrote that people don't write the history in factories in their lives, they get lost, and the facts get lost. It was very important in the McPherson inquiry that there was a link between the home and the school about trying to explain the link about why the murder took place and the socioeconomic impact of them. And I think that this becomes linked to something. They'll have to become more political. Political illness is always seen as something negative, right? But what I mean by that is that advocating for your the people you're looking after and making the scientific explanation about what exactly has happened to them so it doesn't remain hidden, and making that connection will make a difference. If the social worker from the hospital can explain why somebody was discharged with COVID into a care home and the other people that died and what's happening to people linked to schools and their communities, the truth will be able to come out much more clearly, and it'll be factually based, and you'll be able to put forward an argument by why something should be done about it. We should join up the different parts to come to a whole answer. And I think this is very, very important. And that's what happened in McPherson. People joined up what was dysfunctional around the school and what was happening in the local community and why it pointed to institutional racism and message from the police. Social workers are uniquely placed to be able to give that evidence and actually to be accepted because they both know the client and academic evidence that backs up the case that there's a connection between the two. And once you make a connection between the two, the government will not be able to lie about the whole and not take responsibility for what happens. So it's very important that we have people that can be seen as independent, who can say clearly this is institutional racism and negligence by the government for both preparing for COVID and doing anything about its outcome and should be held responsible.
Mike, can I just come in?
Yeah, of course.
Yeah, there's something that we haven't mentioned. I mean, we've been obviously focusing rightly on institutional racism, but you know, brutal, you know, kind of ugly racism as well, far-right racism, also we need not to take our eye off. There was a very important report by the Zinc Network, which is a communications agency that tracks disinformation and propaganda, that was published last week, and you can look it up in The Guardian. And they showed evidence that far-right groups are really active at the moment, even more active in the UK, around Europe and the US, to utilize the pandemic to bring a new kind of relevancy to support their key grievances and to promote fascism. And we really need to look at that. They're doing all kinds of things. They're putting out a false propaganda about BAME communities spreading the virus, as well as trying to glorify their own leaders. There was an example of Nick Griffin posting images of himself giving food to white communities in parcels, and that somehow they were the saviors. And in America, there's a massive growth in survivalist far-right group material, almost preparing for some kind of COVID-initiated race war. Now, you might think that these are just kind of nutters on the sidelines, on the fringes, but I know Weyman's done a lot of work in this. You know, we can't take our eye off them.
Yeah.
Weyman, do you want to come back?
Can I support Gurnam in that? Because two national figures have come to this. This is Mario Salvini and Viktor Orban, who have actually reversed. I mean, for instance, Orban has denied the Holocaust took place in certain ways, or rewritten it and connected it now to what I call the modern, you know, the black and ethnic communities now, and saying this disease was brought in because of the consequence of that. And really, I hate to say this, but I'm concerned about mass unemployment and austerity sharpening these very things and making it difficult when we come back. So we have to use the time we have now to explain institutional racism, but to stop an explosion afterwards, because the amount of people that are going to be made unemployed, and also we're going to have to protect social work and protect the NHS. Because I know they say people are national treasures now, but look what they did to that wartime generation inside the care homes. Look how they allowed them. They say they're a treasure, and then look how they really treat them and say they shouldn't get treatment. I think the institutions that they say they want to protect, the NHS, social workers, will bear the brunt of many of the attacks to come. And it's very important that we expose, not allow false arguments of racism and division to become the explanation, in order to do both things: protect the services we've got, but also fight against institutional racism and also the far right groups that will thrive off of that.
Okay, so we've talked around first of all in terms of the institutional and structural nature of racism. We've looked at what the implications are for social work. I think Weyman in particular talking about, in some senses, the privileged position of social workers and the fact that we deal with day in, day out with people in the communities, in the health system, in the care system, and we have an insight into their lives which we really have a responsibility to talk about and to raise and to profile. So that takes me on to my third question and the final question. So I'm going to start with Weyman, but that is a simple question in a sense, but what's to be done? What demand should social workers make on government, on local authorities, on care providers, and maybe even on the NHS? What do you think we should be doing over the next few weeks and months? Weyman.
Firstly, we have to find the truth out. We have to be the truth bearers. It is not an accident John Bowlby or anybody that was involved in education were at the forefront of bringing to truth about what happened to people. We have to tell the truth. We have to join up the truth. We also have to be part of a public inquiry. Social workers were central to the Macpherson inquiry. They refused to back down by simply saying that this was a simple murder. They connected it to the institutions. And the final thing is, I know this is a strange thing to say, I think we're going to have to fight very hard to keep our services. If there's a 35% cut in GDP, and I don't want the argument, there's nothing we can do but reduce social services. We've seen what's happened with the impact of austerity, and they're saying it's worse than the 2008 crisis. We have to fight racism very hard, but I'm really worried that what will happen is there will not be a protection of the services that we need. So I would like us to make sure we do those things and support Diane Abbott, Bell Ribeiro, Claudia Webb on their call for a public inquiry into what happened to COVID and hold the government to account.
Weyman, thanks very much. Gurnam, on the same question, what do we think we need to do now?
Yeah, I'm going to pick up from where Weyman left off, really. I think you know, social workers have been criticised for many years about, you know, being do-gooders, liberal lefties, and are politically correct, obsessed with. But really, all of those critiques of society that social workers have been making, you know, about being caring, really kind of seeing care and not commoditizing money as the kind of way in which you organize society. I think that in some senses, you know, that's now becoming mainstream. So I think that social workers need to be congratulated for the kind of stances that we've been taking, and you know, radical social work explanations. It seems to me absolutely critical if now as at any other moment. But let me just, I'm going to start off with the refugee and asylum seeker communities, both documented and undocumented, because let's be honest, they are the most vulnerable now. They're the ones that actually nobody's really, you know, as it were, representing, counting. So I would say that, and I think that Swan needs to take this up, that all asylum seekers, whether they're documented or not, need to be given temporary citizenship rights, yeah, in this country, and that their human rights should be safeguarded legally, and that they should be told that that will be not detrimental to their asylum claims. So I think that's something that we should be doing. And all barriers to healthcare for that group need to be removed, absolutely. Because if we don't do that, Mike, then they're likely to die, suffer in silence, and nobody's going to actually do anything about that. I think there's been an amazing explosion of community activism. And again, I think that's another tradition of social work, about getting involved in the community. I can remember when we had the fire in West London, it was social workers that came in there and supported the community groups to really get things done. And I think that, you know, here's another example. So, you know, we need to support community activism. There's been lots of work done by voluntary groups, the mosques, the gurdwaras, the mandirs, churches. But those groups, their funds are drying up now. They've been providing food to communities. So I think, again, we need to be able to get some resources to those people. There's issues around funeral, around kind of cultural knowledge, really, that we need to generate. I mean, we've touched on hate crimes, so really, we don't really need to go any further on that. But just for BME staff, I think we need specialist counselling. I think that, you know, for them, their situations are unique, and we need to be able to connect into that. But in terms of the longer term, definitely that the inquiry needs to happen, and it needs to be a properly democratically accountable inquiry. And I would say we need to massively resource social work and social care. And, you know, we need to hold this government to its own propaganda. You know, if they say that these industries really do matter, in fact, they've proven that they matter, because when you know, capitalism fails, then it is ordinary people who have got care at their kind of core that come forward. So I think we need to really strengthen the profession. Now, will the government do that? I don't know, but you know, we can keep fighting.
Okay, so that really brings us to the end of our discussion this afternoon. I'd like to take this opportunity on behalf of the Social Work Action Network of thanking both Gurnam and Weyman for their contribution. They responded very quickly to an email asking them to come on and give us some information about these. And this is the first of a number of podcasts that Swan are going to be conducting over the next few weeks around specific themes, when we'll try to bring experts in to look at what the questions are and what the potential solutions for a more radically engaged social work should be. Thanks very much for watching.